You know, Jessie, you obviously talk a lot about the cancer care and the quality of care that's happening. I feel like we in the media don't talk about that as much. We talk about diagnosis, or we talk about treatments. We don't necessarily talk about care enough, which may explain why more people are going to write to you about this stuff. So what could we do better on that front?
Well, it's not really news, you know. The quality of care, unless you're talking about how tragically poor it is in some cases, it's not really news. But so much of what appears now kind of ostensibly as news might be news you can use that would be actually very helpful for many people. I had the experience of when I was diagnosed with my third cancer I hadn't been diagnosed with cancer for a long time prior to that, and I was just stunned by what it takes to find the right care and then to make the most of it. I was just bewildered. You know, with all of my expertise and all of my experience as someone who has been kind of intermittently ill, I really struggled to find the right doctors, to choose the right treatments, to get the right hospital. I mean, the whole thing was bewildering to me. I thought, you know, if this is so hard for me, what must it be like for others? So I decided I was going to write about this, but that I couldn't base it only on my own experience. So I started interviewing people, and I ended up interviewing over 200 people about their experience with not cancer care, but just getting a bad diagnosis and then trying to figure out what to do in response to it. And it took 200 people until I finally figured that I was getting similar stories and I understood kind of what the phenomenon was. 200 people, one person said, you know, it was like getting on a train, and I just stayed on the train, and I went through my whole diagnosis and treatment. It was just effortless. One person. The other 199 talked about how difficult it was to figure out what doctor, to get a diagnosis, to figure out the insurance, it was just astounding to me. This is a huge gap in what it is that people need to know in order to actually benefit from the health care that's available to them. I wish it was more newsworthy. I'm afraid it's not. It really is very kind of down and dirty, how-to, detailed stuff that we need to know in order to wring the best possible benefit from the extraordinary technologies and drugs and services that are available to many Americans today.
And it's something, is it just not anywhere?
Pardon me?
Is it just not anywhere? Do you feel like you've had to sort of create this sort of silo of where to get information? I mean,
you can find it periodically, or kind of sporadically in different places. Since discovering this, we at the Center for Advancing Health have spent a lot of time trying to gin up interest in providing that kind of detailed guidance and help to people in order to actually make the day-to-day decisions. Like, how do you actually tell your doctor you want a second opinion? And then where do you look for somebody to give you a second opinion? And then what do you do with the information from the second opinion? I mean, this is not easy stuff, but believe me, it is molecular. And it's not interesting to many people unless you're the one who needs it, or somebody
the minute you get diagnosed.
Pardon?
The minute you get diagnosed, then you're looking for that information.
Right. Well, first of all, for many people, getting diagnosed is a months-long process, and that's not only with cancer. It's many diseases. So the diagnosis just floats around out there. And how do you actually settle on that? How do you manage the insurance, the health plan, which doctor, in order to actually get there? I mean, getting health care now, this is the paradox of the advances in medicine. Is in the old days, there were few choices. Now we have so many choices, we have to be really sophisticated. And in some ways, this is where the media comes in really informing us about the differential in quality of care, the differentials in treatments and effectiveness in treatment, cost of treatment, side effects of treatment. There's a tremendous amount that the media could do to deepen our understanding of what it means to be sick. Unfortunately, most of us, unless we are sick with that disease, are not reading this stuff.
Right.
You know, so there is a problem with that as well. You know, we're all of us, me included, on a need-to-know basis, which means that the news cycle doesn't always match our needs. So it's really important that there be places, and NCCS is one of the places that really takes a corner of this market and says, here are things that you need to know about different aspects of survivorship. Here is a trusted resource. Here's a place you can go. Here are resources that are permanent that really can help.